Okay, so today we are going to show you, I'm going to show you the NR 304 head to toe return demonstration. Now, one of the things to keep in mind is that your lab professor is going to show you this return demonstration. Please make sure you follow their guidelines when you are repeating this. All of the bolded items must be complete in order to pass your return demonstration. So I will highlight all of the bolded items. You might see a few of the items that are not bolded, and that is okay to put those in, but you do not necessarily have to put them in if you do not want to. So Professor Tate has agreed to be my patient today, so we are going to go ahead and get started. Okay, so knock, knock, knock. Hi, my name is Krista. I'm going to be your nurse today. I'm going to do a head to toe assessment to make sure everything is working in working order. It should take me about 20 minutes. Is that okay with you?
Yes.
Great. Let me close the curtain for privacy and wash my hands. Can you tell me your name and date of birth, please?
Jennifer Tate, August 10th, 1985.
Perfect. So, are you in any pain?
No.
Do you have any allergies?
No.
Okay. When I look at Professor Tate, I don't see any signs of acute distress. When she is talking to me, she is smiling, she's in a pleasant mood, and her speech is clear. When I asked her name, she knows her name. Can you tell me where you're at?
Chamberlain Hospital.
Can you tell me what day it is?
Today is Tuesday.
And why are we here?
To be assessed.
Okay, so she was able to answer who she is, where she is, what time it is or the day, and the situation. So she's alert and oriented times 4. I did her vital signs. Those were within normal. Now, when I look at Professor Tate's skin, I see that the skin color is consistent throughout. I do not see any wounds, lesions, or incisions. And when I palpate her skin temperature with the back of my hand, it is nice and warm, consistent throughout. Now, when I look at her fingernails, I see that Professor Tate's nail beds are a nice pink undertone. There is no abnormal shape or clubbing present. When I press on her fingernails, the capillary refill returns within 1 or 2 seconds, so that is a normal finding also. Now I'm going to go on to the head, face, and neck. When I look at her facial features, they are all symmetrical. When I look at her head, I don't see any kinds of infestations or lesions. And when I palpate, I don't feel any lesions or infestations. Now I'm going to test for cranial nerves 5, 7, and 11. I'm first going to ask you to close your eyes, and when she has her eyes closed, I am going to touch different parts of her face. Tell me when I'm touching you.
Yes. 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 Yes.
Wonderful. You can open your eyes. So the sensory function of cranial nerve number 5 is intact. Now I'm going to have you clench your jaw shut for me, and then go ahead and open. And she was able to overcome resistance, so the motor function of cranial nerve number 5 is intact. Cranial nerve number 7, can you smile really big? Can you puff out your cheeks? And raise your eyebrows for me. She's able to do all of those actions, so cranial nerve number 7 is intact. I'm going to have you shrug your shoulders up and down and turn your head side to side. Okay? And I'm going to put resistance against your shoulders. Go up and down. Perfect. And turn to the left, and then turn to the right. And she was able to do that both with and without resistance, so cranial nerve number 11 is intact. I move on to her eyes. When I look at her external or her extraocular structures, I see that they are free from drainage, discharge. There's no redness there. I'm going to have you pull your lower lids down, and I see that her conjunctiva is pink and moist, and her sclera is nice and white. You can let go. And now I'm going to look in her pupils, okay? When I look at Professor Tate's pupils, I see that they are equal. They are both round at 4 millimeters. They were both reactive to light. Now I'm going to test for accommodation. Please look at this pin light and follow it towards your nose. And her eyes converge, so accommodation is present. Now I'm going to test cranial nerves 3, 4, and 6. I'd like you to look straight ahead and not move your head at all. Just follow with your eyes.
Okay.
Perfect. So Professor Tate was able to do that, so cranial nerves 3, 4, and 6 are all intact. I'm going to look at her external auditory meatus. There's no drainage or discharge present. I'm going to have her cover her left ear, and I'm going to say oxygen.
Oxygen.
And she heard me say oxygen. So this ear is intact. I'm going to go to the other side and look at the external auditory meatus. There's no drainage or discharge present. So I'm going to have her cover her right ear, and I'm going to say Hillrom.
Hillrom.
And she hears me say Hillrom. So the fact that she heard me and passed the whispered voice test tells me cranial nerve number 8 is intact. I'm going to go to her internal structures of her nose. When I look in her nose, I don't see any asymmetry. There's no inflammation. There's no deformity. There's also no drainage on the external portion. I'm going to have you plug one side and breathe in and out and repeat with the other side. And she's able to do that, so her nares are bilaterally patent. So now I'm going to go to her mouth. When I look in her mouth, can you say ah for me?
I have a mint in there, sorry.
I see that her lips, her tongue, and her gums are pink and moist. So in the mouth, I'm also going to be testing cranial nerves 9, 10, and 12. So for cranial nerve 9, I'm going to ask Professor Tate to go, ah. Okay, and when she does that, I'm looking in her mouth to make sure the soft palate and the uvula rise equally together. They did, so cranial nerve 9 is intact. Now I'm going to pretend, and I'm going to take a tongue blade, and I'm going to elicit the gag reflex by touching the back of her throat. So, and she gags. So cranial nerve number 10 is intact. Now I'm going to ask you to repeat light, tight, and dynamite.
Light, tight, dynamite.
She can say those, so I know cranial nerve number 12 is intact. So we're done with our cranial nerves. I'm going to go to the respiratory section. I do not see any accessory muscle use. I'm going to go to her right upper, her left upper, her left lower, and her right lower. Her anterior lung sounds are clear to auscultation. Now I'm going to have her kind of turn that way so you can see the back. And we're going to do her left upper, right lower, left lower, and right lower. So her posterior lung sounds are clear to auscultation. I'm going to go ahead and move on to the cardiovascular. I'm going to first do all of my pulses. I'm going to cluster them together. So I'm going to check her carotid pulses. They are strong and equal. I'm going to check her radial pulses, and they are strong and equal. I'm going to come down here to her feet, and I'm going to do the dorsalis pedis, which is on the top of her foot. Those are strong and equal. And then I'm going to go to the posterior tibialis, which is behind the ankle on both of her feet. Those are strong and equal. As I checked her pulses, I also noted that there was no edema present. So I'm going to come back up and let's do the landmarks. I'm going to use my diaphragm first, and I'm going to go to the second intercostal right sternal border for aortic, second intercostal left sternal border for pulmonic, third intercostal left sternal border for Erb's point, fourth or fifth intercostal left sternal border for tricuspid, and then fifth intercostal mid-clavicular line for mitral. S1 and S2 are heard. I'm going to flip to my valve. Aortic, pulmonic, Erb's point, tricuspid, and mitral. No murmurs were heard. So I'm going to ask Professor Tate to kind of sit this way for me. Now I'm going to do the gastrointestinal assessment portion. So this is a short section for you guys. When I look at Professor Tate's abdomen, I see that that it's symmetrical and the contour is nice and rounded. Now I'm going to listen with the diaphragm, and I'm going to listen to the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So vowel sounds are present in all 4 quadrants. Now I'm going to palpate in that same order. Right lower, right upper, and left lower. I noted that there was no masses, there was no guarding, there's no distension noted, and Professor Tate didn't exhibit any kind of tenderness. Okay, so I'm going to have you set back where you were, please. So now we are going to go to the musculoskeletal section. I have decided to utilize the hands, the elbows, the knees, and the ankles. So when I look at the hands, the elbows, and the knees, and the ankles, I see that they are all symmetrical to each other and there is no abnormal contour noted. Now, for your elbows, I'd like you to put your arms out and then bring them back and put them out again, and now turn down and then turn back up. Perfect. Now you can relax your arms. For your hands, I'd like you to make a fist, open them up, and then take your thumb to your fingers for me. Perfect. Okay. So for your knees, I would like you to bend in and out for both of them, please. There you go. And I'd like you to get up and take a few steps. Great. So while Professor Tate is ambulating, I can also note that she has a steady gait, which is one of the bolded items. So for your ankles, I'm going to have you point down and point up. Perfect. On both of them? Great. Now, what I'm going to do is provide resistance for all of those range of motion movements. So for her feet, I'm going to have her raise up against my hands and now push down. Great. Try to kick out, okay, and try to pull in. All right. Now, I'd like you to have your arms up like this and push out and then pull in. Great. And now for your hand, your grip strength, just squeeze my fingers. Wonderful. Okay. One last thing, I'd like you to close your eyes, and then when you open your eyes, tell me where I touched you, please. Great. So sensory function is intact in the lower extremities also. She has full range of motion, full strength, everything was nice and equal. I hope I did not cause you any pain. Are you in any pain?
No.
Okay. I'm going to make sure that I put the bed in the lowest locked position with the side rails up. I'm going to hand her the call light as I exit the room, and I'm going to wash my hands. And that is your head to toe assessment.
Awesome.